Bismillahirrahmanirrahim. Assalamu alaikum. Welcome to our new video of the series of osteology of skull. इस वीडियो में हम नॉर्मा लिटरालिस के बारे में डिस्कस करेंगे, उसके कुछ बोनी लैंडमार्क्स और इम्पॉर्टेंट रिलेशंस के बारे में बात करेंगे. First of all, we will discuss the bones that take part in the formation of the norma lateralis. इस lateral view में हमें जो भी bones नज़र आएंगी, they are actually part of that view. Starting from above downward, हमें सबसे पहले lateral aspect of the frontal bone नज़र आता है. Then we have the parietal bones above, the squamous part of the temporal bone, the mastoid process of the temporal bone, the occipital bone, some portion of the occipital bone posteriorly. We have the mandible below, the sphenoid bone, the zygomatic bone, the maxilla and the nasal bone. Upper aspect पे हम कुछ sutures देख सकते हैं. The frontal bone forms coronal suture with the parietal bone. Here you can see the lateral aspect of the coronal suture. Frontal bone below it forms the suture with the frontal process of the zygomatic bone. This is the frontozygomatic suture. Here it forms the suture with the sphenoid bone. Frontosphenoid suture here. The parietal bone forms suture with the temporal bone. This is the temporoparietal suture here. Here you can see H-shaped suture that is formed between the frontal, the parietal, the temporal and the sphenoid bones. This H-shaped suture, this point is known as pterion. P-T-E-R-I-O-N, pterion. And this point is important landmark for the passage of the middle meningeal artery and vein. यहाँ पे जहाँ पे फ्रंटल बोन एंड द zygomatic bone forms a suture, यहाँ से अगर आप नोटिस करें तो हमें एक लाइन नज़र आती है. This is known as the temporal line that extend upward and backward. As soon as the temporal line crosses the coronal suture, it divides into two: superior temporal line and inferior temporal line. सुपीरियर टेम्पोरल लाइन जो है वो बैकवर्ड एंड पोस्टीरियरली ट्रैवल करती है और वो पीछे जाके वैनिश हो जाती है, जबकि जो इन्फीरियर टेम्पोरल लाइन है वो हमारे पास पीछे की तरफ ट्रैवल करके इट देन एक्सटेंड डाउनवर्ड एंड इंटीरियरली एंड इट क्रॉसेस बिलो. यहाँ पे ये इट कम्स एंटीरियरली एंड इट जॉइंस दी zygomatic process और zygomatic arch of the temporal bone here. यहाँ पे जब ये क्रॉस करती है तो दिस inferior temporal line it forms a crust shaped structure and this is known as this thickened part is known as the suprameatal crust here. Now talking about the sutures which are located posteriorly. Here you can see we have the parietal bone, the occipital bone and the mastoid part of the temporal bone. Mastoid part of temporal bone and the occipital bone, they both form a suture. This is known as the occipitomastoid suture. Parietal bone or the mastoid process, they form the suture that is known as the parietomastoid suture here. These two sutures join together at the posterior suture that is the lambdoid suture. Lambdoid suture is formed between the parietal bone and the squamous part of occipital bone. So these three sutures combine together at this meeting point and this junction of suture is known as the asterion. So anteriorly we had the pterion. The pterion was formed between the temporal, the parietal, the frontal and the sphenoid bones. This is an H-shaped suture. Whereas posteriorly we have the asterion which is formed between the lambdoid suture, the parietomastoid suture and the occipitomastoid suture. This conical projection here, it is the mastoid part of the temporal bone. It is the mastoid process basically. यहाँ पे अगर आप गौर करें तो हमें यहाँ पे एक foramen नज़र आता है. This is known as the mastoid foramen. Mastoid foramen अगर हम interior of skull तक इसको trace करें तो it opens into the sigmoid sulcus. We will discuss that in the topic of interior of the skull. Now anterior to the mastoid process, we have this antrum or this passage. This is known as the external acoustic meatus. External acoustic meatus is basically formed by tympanic plate. Here we have the tympanic plate. Here, this is the tympanic plate. And it is formed by the temporal bone above. This tympanic plate basically forms the inferior, the anterior and some portions of the posterior walls of the external acoustic meatus, जबकि बाकी portions जो हैं they are formed by the temporal bone, squamous part of temporal bone. ये जो आपको outer outline नज़र आ रही है, this gives the site of attachment for the cartilage of the external acoustic meatus. As I have told you कि जो inferior temporal line है that extend downward and anteriorly as the suprameatal crust here, यहाँ पे अगर आप notice करें, just above the external acoustic meatus we have a triangular shaped area. This triangular shaped area is known as the suprameatal triangle. Suprameatal triangle की जो आपके पास anterior जो इसका border है, here anterior border, it is formed by the inferior temporal line, यानी कि suprameatal crust. The base of the triangle, suprameatal triangle, is formed by the walls of the external acoustic meatus, the posterior superior wall of the external acoustic meatus, और जो इसका posterior जो line है, that is basically an imaginary line जो कि हम tangent बनाते हैं. Tangent basically crosses the posterior superior wall of the external acoustic meatus and the suprameatal crust below and inferior temporal line above. तो यहाँ पे आपके पास एक rough triangular shaped structure बन जाता है. This is known as the suprameatal triangle. And this suprameatal triangle is basically the area जिसके deep down हमारे पास mastoid antrum present होता है. Now coming anteriorly, यहाँ पे अगर हम notice करें, यहाँ पे we can see the frontal bone above, the zygomatic bone below. The zygomatic bone basically gives two processes in the lateral aspect of the skull. वैसे तो ये तीन process देता है. एक anteriorly देता है which is the maxillary process of the zygomatic bone that forms a suture with the maxilla, and it can be seen in the Norma frontalis. Here it is giving two processes. One is the frontal process and the other is the temporal process. This temporal process basically combines with the zygomatic arch of the temporal bone. यहाँ पे जो temporal bone है, it gives a long projection, finger-like projection. This is known as the zygomatic arch or the zygoma of the temporal bone. It articulates with the temporal process of the zygomatic bone, and this articulation or the suture is known as the temporozygomatico suture. This zygomatic arch divides this area into two parts. This is the temporal fossa here. यहाँ पे हमारे पास temporalis muscle की attachment होती है. And below the zygomatic arch we have this area. This is known as the infratemporal fossa जो कि mandible के medially lie करता है. The temporal muscle from the temporal fossa, it comes downward. इसका जो tendon है वो हमारे पास इस area से cross करेगा, इस gap से, and it will be attached on the coronoid process of the mandible. ये जो zygomatic arch यानी कि zygoma होता है, it has two surfaces. This is the outer surface and one is the interior surface जो कि अंदर की तरफ होती है. Anteriorly, it is formed by the sphenoid bone, some part of the frontal bone and the zygomatic bone. And posteriorly, ये जो zygomatic arch है, it converts or it divides into two roots. This is the anterior root and this is the posterior root. Anterior root and posterior root. The posterior root of the zygomatic arch is continuous with the suprameatal crust, and then it continues as the inferior temporal line above. The anterior-most point of the zygomatic arch is known as the jugal point. This zygomatic arch has two borders. This is the upper border, this is the lower border. So basically it has two surfaces, outer surface, that is the lateral surface and the medial surface inside, two borders, upper border and the inferior border, and two roots. One is the anterior root and the other is the posterior root. अगर हम थोड़ा inferiorly notice करें तो यहाँ पे जो zygomatic arch है that basically forms the area for the condylar process of the mandible to articulate. This articulation is known as the temporomandibular joint, and this area where the condylar process articulates is known as the mandibular fossa. Here you can see a bony projection, this point. This is known as the articular tubercle of the zygomatic arch. Here at the inferior aspect of the zygomatic arch, we can see a tubercle or bony projection. This is known as the articular tubercle. The zygomatic arch on the inferior aspect, it forms a fossa. This is known as the mandibular fossa. Mandibular fossa basically lodges the condylar process of the mandible and it forms the TMJ, that is the temporomandibular joint. अगर हम mandible को थोड़ा सा remove करें, so here you can see a bony projection, a bony finger-like projection. This is known as the styloid process. Styloid process basically हमारे पास mastoid process के anteriorly present होता है. Just deep to the mastoid process, we can see a notch. This notch lodges the posterior belly of the digastric. Medial to this notch, we have a groove. इसके through हमारे पास occipital artery run करती है. Anterior to the mastoid process, I have already told you, we have the styloid process. And in between the mastoid and the styloid processes, we have a foramen. This is known as the stylomastoid foramen, which allows the facial nerve to pass through it. So basically, this was all about the basic landmarks and important features of the Norma Lateralis. I hope so कि इस वीडियो से आपको थोड़ी बहुत help हो गई होगी. Thanks for watching. Now we'll meet in the next video of this series. Thank you.